A very good evening and welcome to Point Blank. My name is Ibrahim Kwarteng, and tonight we look at another important issue, that is the Public Health Act, with emphasis on the prohibition on public smoking. But before I introduce my guest and other colleagues with you, let me quickly run you through the subject. Tobacco is said to contain 7,000 chemicals, 70 of which causes cancer. Health experts say those who inhale the smoke are exposed to the chemicals and are at risk of the adverse health consequences. It is against this background that the Public Health Act 2012 was enacted to protect the public against the harmful effects of tobacco smoking. The ban on smoking in public places is to ensure that non-smokers are protected from the adverse effects of tobacco smoke, considering the overwhelming evidence of its harmful effects. The Act further stipulates that all persons in charge of places where smoking is prohibited are required to post signs that clearly indicate that the establishment is a no-smoking area. We will devote this edition of Point Blank tonight to the Public Health Act with emphasis on the prohibition on public smoking. Mrs. Olivia Boateng is the head of Tobacco and Substance Abuse Department of the Food and Drugs Authority. Madam, you're welcome.
Thank you very much.
And I'm sure this is your first time on Point Blank.
Yes, this is my first time.
Right, you're welcome once again. And to help me look into detail, the subject is Jonathan Thompson of GBC Radio and Norman Cooper of The Spectator. But now, Madam, let's come to you. Reading the intro, you realize there is some sort of frightening statistics out there. We are told that tobacco is said to contain 7,000 chemicals, but 70 of these chemicals cause cancer. What comes into your mind when such thoughts come to you? 70 causing cancer.
You agree with me that is very frightening. The evidence abounds, is overwhelming, that every 0.65 seconds somebody dies from tobacco use, and then it kills over 6,000 or 6 million people in a year. 600,000 of these people are even non-smokers. It affects every part of your body. It affects from the head, your head, to the sole of your feet. And so, because of these overwhelming effects, the Public Health Act Part 6 have been introduced to protect everybody, including the smoker, from all these health hazards associated with tobacco use. The key areas that the provisions talk about are what you mentioned in your intro: prohibition of smoking in public places. And then you rightly said that it is not just the smoker who is affected by these chemicals you mentioned, but the person who happens to be in the presence of the smoker, a phenomenon we call passive smoking. You inhale as much as he does, what he puffs out, and then you are likely to get all the effects we are talking about. And so these comprehensive smoke-free policies are there to protect the non-smoker. Another provision is packaging and labeling requirements. What we've realized is we have a ban on tobacco advertising, promotion, and sponsorship. So the tobacco industry would want to use the package as an effective means of communicating misleading information. I mean, they think that smoking is glamorous. They could say that it will improve your state of well-being and all that.
Right, Madam, so I'm sorry to cut in rudely. We will come into that. But then, why has it taken so long for the Public Health Act to come into being?
Well, it's not taking that long. Even before the law, we have done extensively a lot. What I was mentioning about the packaging, what is required of tobacco industry, the ban and all those things, Food and Drugs Board had been able to enforce them using the ministerial directive. But really the bill was not up to only food and drugs. We had to go through a lot, including the lawmakers, till eventually it was passed.
Right.
So what does the prohibition of smoking in public places intend to achieve?
What it seeks to achieve is to protect the non-smoker against all the health hazards associated with tobacco use. We are saying that the chemicals, more than 7,000, are toxins. There's no good benefit derived from tobacco use. These are cancer-causing They will cause the lung cancers, the heart-related diseases. In fact, when children happen to be by parents who smoke, it affects them. The rates of those who are asthmatic gets asthma attacks. It increases their rate of getting upper respiratory tract infections. When a pregnant woman happens to smoke, she may deliver a child with low birth weight, or may even lose the child. There's a phenomenon we call sudden infant death syndrome. The children below 1 year die spontaneously. So all these effects would happen to somebody who would be in the presence of a smoker. And so these prohibitions are there to give them a right to a smoke-free environment, so that you can happen to have a service or go and have fun at a public place and not be exposed to second-hand smoke.
Okay. This year's World No Tobacco Day, it's always celebrated on the 31st of May. This year's theme is ban tobacco advertising, promotion and sponsorship. Now, I would like to know how you actually are working with the Advertising Association of Ghana to actually make sure that you regulate the advertising of these things.
What we have done is not to work with the advertising agency, but to work with the tobacco industry. The products they bring in is regulated by the authority. Okay. And so we insist that they do not do adverts, they do not sponsor beauty pageants, reality shows like Miss Ghana and all the shows we have on TV. You would realize that there are no branded vehicles of the tobacco brands. You don't have giant billboards. You don't have it in electronic or print media. That is an extent that we've gone with the industry so far. Yeah. But it is not with the advertising agency that we have dealings with. We
now
interact.
They are the body, the Advertising Association of Ghana. That's the body that regulates.
Yes, that is the body that does the regulation. But the law makes provision for the industry to be restricted. They are bringing in their products, but we also restrict what they have to do when the product is in. Okay. And so it is easier. They are supposed to register with us as importers, and then because they want to do business, they comply. You are not supposed to advertise your product, and so it won't even get to the advertising agency in the first place. Okay. It is when we see the advert that is when we may involve the advertising agency. Well, the ban, the theme this year, it's saying that a complete ban on advertising, promotion, and then sponsorship. Even though I was saying that we have been able to do it even without the law, indirectly we see key rings, paraphernalia, brands on T-shirts, and so that is where we are directing our energies to now. Indirectly, they would want to go behind the scenes and do that. And so the complete ban, the theme for this year, is to ensure that we get rid comprehensively of any form of adverts, either directly or indirectly.
Okay, let's go back to the causes of the health implications of using tobacco. Now, you're talking about just tobacco smoking, but then I do know that tobacco in its raw form in some countries is actually treated as food. Some even take it as medicinal. And I really want to know if you do know about this. And what do you have to say about it?
Yes, that's why the law is for tobacco and then all tobacco products. It's not just the tobacco smoke. And the smoke contains the chemicals we are mentioning, but the tobacco itself, in any form or preparation, causes all these health implications we are talking about. So we are talking about the snuff, we are talking about the leaves. If it's even, some people have it as tea, it will still contain the nicotines and the formaldehydes and the ammonia and lead, all the toxins we are talking about. Okay. So we regulate all those. The law mentions tobacco and all tobacco products.
So which areas are prohibited from public smoking?
The areas are listed in the law, and they include places such as factories, all offices, workplaces, educational facilities, institutions where children are cared for, all recreational facilities, pools, whether enclosed or opened, the bars, pubs, restaurants, places of collective use. It mentions public transport terminals and then public transportation systems. The list is endless.
Right, and let me ask you this one. So you are, the FDA is a law enforcement body. Have you gone round, perhaps to find out whether this rule is being adhered to? Because you go to the places you've just mentioned and people are still smoking.
Yes, the implementation started with continuous public education, like what we are doing now on the airwaves, interaction with the media and with publications, the press release you mentioned. The whole emphasis was to let people know about the law, understand why there's the essence of the law, to protect them, to give them a smoke-free environment, and then to let them appreciate the essence. Once we did that intensive education, because we think once the person, he or she knows the health hazards involved in the tobacco use, he won't even allow somebody to endanger his or her life, and then would ensure voluntary compliance. So we think the education has gone on extensively well, and so we have gone round to meet target groups. You mentioned the hotels and pubs. How are we enforcing? We met the hotel industry. We met those in Accra. We have officers in the various regions, so they are also meeting the various groups and told them what is their role in the law, what they are supposed to do. And when you mentioned the owners of these premises are supposed to do signage, what we mean signage is put no smoking signs at their establishment or designate a smoking area if they want to. And then the onus is on them to insist that the place is a no smoking area. So after we have done this, we've gone around monitoring routine and unannounced surveillance activities. And so we've been at the malls, we've been somewhere that they had, the place was no smoking area, but they had canisters just before you enter the door. They are not supposed to display ashtrays, canisters, not to make provision for somebody to smoke. So we are going around insisting on compliance.
Looking at the range of diseases, as we can rightly see on the board, why should anyone authorize tobacco to be imported into this country?
Yes, that's a very good question. People think that if it will cause that damage to us, why do we have to allow it into our country and then bring comprehensive smoke-free policies to protect them anyway?
Exactly.
But you know, we are part of a global village, and this international free trade affects everybody. You cannot sit in Ghana and say that you won't allow tobacco in your country. In fact, if you do, then you are going to condone smuggling and illicit trafficking. Then you cannot even control the industry. So what we have done is to regulate them such that what they even bring into the country, they would have to put textual health warnings or health warnings that will inform whoever wants to smoke and then demotivate even people from smoking. They have to write that the diseases that you see, if you smoke, you would have this, you would have that. So we let it in, but at the same time protect individuals from the harmful effects.
Have you made any progress ever since the act was passed?
I think we have extensively. We see this in the complaints we are having. We designed complaint forms and put out phone numbers, contact numbers for people to call us. And the places we've gone to monitor for compliances, people are complying. We've been to hotels that management were ready for us, showed us around the establishment, thought they had no smoking area, or they had, but it was such that they would expose, let's say it's at the poolside, it's an open place. And so for people who do not smoke and who come there, they'll be exposed to, so we told them no, the designated area should be an enclosed area so that it doesn't spread to the no smoking area to endanger people's lives. So we think people are complying extensively.
Madam Olivia, I'm sure you must be worried about the health hazards of smoking. If our cameras will just zoom onto the pictures that we have, you must be really worried. My problem is this: looking at the health implications, no respecter of persons. Why should there even be a ban on public places and not public and private places? That it's ironical, because at the end of the day, whether public or private, those who take it are at risk.
Like you rightly mentioned, it is not good for anybody at all, whether in your home, in your car. But the framers of the law also thought it wise that people have rights. So they would also come out and lash as you are infringing on their rights. So the law is there to educate. There's even provision for public education to educate people to know the health hazards that is worrying that they are talking about. And so he or she is informed to whether have a choice to smoke or not to smoke. So we did not outright, the law does not go into people's private homes, even though we know vulnerable people are in the homes, especially the children. So there's a provision on minimum age requirements. You are not supposed to sell or offer a child who is below 18 cigarettes. He's not even supposed to light it, and neither is he supposed to sell it or even purchase it. If you are caught, the law will deal with you. So for those who sell it, you are supposed to, if in doubt about the age, get a picture ID to be sure that whoever I'm selling it to is an adult.
Right. Let me just chip in this quickly. We're a bit, let me say, conversant with the public places where people should not smoke. What about private places? Could you tell us where people can smoke? Because I have a problem with the designation of private places. So if you could just enlighten us.
If you say private places, are you referring to people's homes?
Well, that is where the tricky situation is. Where do people smoke? Where can they smoke?
In public places, if there has to be any smoking, the responsibility is on the facility owner to demarcate an area and designate it as a smoking area. So that's supposed to be enclosed. I mean, a cubicle meant for those who only want to smoke. In fact, those places, there's even not to be services provided, because if I allow in staff to serve, give you food and things, you are exposing them whilst you are smoking. So they are just to go in there, smoke, like it happens in the international airports. You find them in cubicles, they just smoke, and then when they are done, they come out. So those places, the onus is on the facility owner to make provision for a designated smoking area.
Let's come home. You're living in a compound house. While your neighbor is close to you. I stay in my room and then smoke because it is my private area. And then it goes into the room of my neighbor. How do we, where do we draw the line?
The law did not make provision for homes. I mean, I'm sure as and when we do the implementation, we can do reviews. But for now, it does not make provision for people, individual homes. What you could just tell your neighbor is to politely tell your neighbor about the health hazards and then tell the person that he or she is endangering your life. But you cannot cause an arrest or effect any arrest of such a person because that's his home. So the law is a bit hollow. Not hollow, but I told you that we are taking the rights, even though we are educating the smoker as well. And it's generally been observed that these smoke-free policies can make a smoker quit. It demotivates them because if even you have to be in a workplace, let's say here, and it's no smoking. I mean, the long hours that you stay here, by the time you go out to your house, that long hours that you stay here, it would have affected you in a way you may quit it. So the law is on their side, but primarily is to protect the non-smoker against. So what you are talking about, it won't go, it's not hollow. We are talking about you who want to enjoy facilities outside with your loved ones, your children, and then somebody will just barge in and smoke indiscriminately, irrespective. So you will know that the law will protect you once you go out these days, because people are health conscious. They will insist on their rights and won't allow anybody to endanger their lives.
So, madam, what does the law say about those who fall foul of the law?
Yes, the penalty for contravening any of these sections is 750 penalty units. A penalty unit now is 12 Ghana cedis. So that translates into 9,000 Ghana cedis, or a term of imprisonment of 3 years or both, depending on the magnitude of the offense. So have you had people falling foul of the law, with some going to prison, for instance? Not yet. We haven't effected any arrest. I told you the emphasis was on the public sensitization of the law and the provisions. Okay.
What we're talking about, let's go back into the preventive way of actually looking at things from that preventive point of view. Now, you're talking about having no control over the importation of these kind of products into our system. Now, aren't you in league with any kind of international organizations like the WHO who know about the health hazards of these things? And isn't there any kind of international control over the trading of such products on the international market?
I did not say we did not have any control. In fact, we regulate it. We control the trade, the tobacco trade industry. We have control over it. And like you rightly mentioned, we have collaborators. WHO is one of our. If you look at the thing we've developed, we did it in collaboration with WHO. So it has both of us our logo there. So internationally, we are liaising with WHO and other agencies. So
And
it is
can't
not
they-
like we do not, we cannot control it. We are controlling it. WHO is will not ban tobacco in any country. They will just make provision like we've done.
Okay.
And there are generalized conventions Ghana is party to, international, it's FCTCs, Ghana is party to. And you are obliged, once you sign those treaties, to protect your citizens using these guidelines and provisions against tobacco use.
And here still, you still have to allow these products into your country.
You do. You still have to and regulate them.
Madam, I'm baffled. Why at all should people smoke?
Well,
Considering all these diseases that
people
are associated with
have
smoking.
varied reasons for smoking. Some is an ego thing. The thing is the in thing. I mean, it makes you a man. Something it will make you slim. For the children, it's peer pressure. I mean, at their parties, they just is one stick and pass around for every. You know what's up, so then you smoke. And people have all sorts of notions. Anti-stress. We've been somewhere in schools and they were telling us that when you are cold and you smoke, you feel warm. And so we tell them, why not put on warm clothing? Why would you smoke, get all these effects we are talking about just because you want to feel warm? So it's a perception. People think it alters their mood. It's a feeling of, anti-stress and all that, but it's just a perception they have.
Let me just add to what my colleague just said. Let me come to doctors without being disrespectful to the profession, because they know better, concerning the health hazards associated with smoking. Cataracts, wrinkling, these are really frightening. Let me ask you a personal one. Why would doctors, for instance, smoke?
That's a choice people make. I mean, like, it will kill you. I'm sure you know that there are certain things that's not good, but you still do it, especially our eating habits. We know excessive amount of sugar. Why? I would ask you, why would you do it? Why would you take too much sugar when you know you may have diabetes or you'll be prone to getting certain diseases? So it's a choice people make, and I think sometimes it's peer pressure. If they start the habit at a tender age, nicotine is very addictive. So to get off it, to quit, it will be so difficult. So people really know they are smoking to their graves, but the willpower to do it is not there.
Auntie Olivia, I had to allude to doctors because they do the cutting, so they see it themselves. I may take excessive sugar, but I may not know, how my body is doing inside there. That is why I had to refer to doctors. So once again, why would they smoke? You are not a doctor, but then look at what we have on the board. I just want you to let us do a little bit of self-introspection. Why would they smoke?
I'm a health professional as well, so I know about the health implications. But like I said, it's a choice people make. People would know that this will send me to an early grave, and because of the addictiveness. And so people are doing it and they don't want to, they want to stop. So in the law, there's provision for addictive diseases centers and then cessation services to be provided for such people. It's on Ministry of Health. They are supposed to establish these units at all our hospitals, our district hospitals, addictive diseases centers, and where they'll provide cessation services, so that people are genuinely in it and they want to stop, because they see this, they hear us talk about it, they want to quit, but they don't have any help, they don't know where to go to. But the law makes provision for such services.
Madam, can you give us some idea about the level of treatment? How much is being spent on an annual basis with respect to treating diseases associated with
yes,
smoking?
all these diseases I talked about or shown on the board are chronic diseases. it affects your whole body. So if you have lung cancer, throat cancer, you can imagine the cost implications. In fact, it's a toll on national health insurance if these diseases are supposed to be covered in the first place. So I don't have it in figures. I wouldn't know the exact amount, but treatment would cost the nation a lot of money. So these comprehensive smoke-free policies, it says that elsewhere it's been introduced and people obliged. It was good economic sense. Eventually, it would affect the economy of the nation positively if people comply with these provisions.
Okay, madam, let's come to second-hand, if it is right to say smokers. I don't smoke, and I'm not sure my colleague does.
No, I don't.
Good.
I don't.
So, but second-hand smokers are usually worried. Why should I, for instance, suffer for somebody's dangerous enjoyment?
Yes, you should be, because like I mentioned earlier, if you happen to be in the person's presence, he puffs out, you inhale it. In fact, from what is coming at the tip of the cigarette, you inhale it as well. So all the chemicals you mentioned in your intro, you are also inhaling it into your system. It will affect your system the same way as it will affect the smoker. That is why you should be worried. It causes heart diseases, and people who already are prone to getting heart diseases, it can trigger heart attacks. It causes lung cancers in non-smokers, people who have never smoked before. In fact, in children, I mentioned that they get these upper respiratory tract infections. It affects their lungs, it's not properly developed. Those who are known to be asthmatics, they get triggers. It can even lead to death. For pregnant women, it affects the unborn baby, low birth weight, sudden infant death syndrome. So the effect is enormous. In fact, it's as much as the smoker would experience. So that is why we are saying that you, the individual, if you happen to be in the presence of somebody smoking, the risk is the same as the smoker.
So if you have a father who puffs it every 10 minutes in the house, it means that the children are in trouble.
Yes, the children, pregnant women, they are vulnerable groups in our society. So I mentioned that the law is categorical on children. So it will take somebody to report that person, because you are not supposed to expose the child to second-hand smoke, to the tobacco product itself, send him on an errand to even buy it, because some of the children says they get introduced to it when their parents send them, because they will tell you to even light it. And by the time you get to your father, you'd want to try it. Children want to, they are adventurous. So that's why, because of their vulnerability, there's a categorical provision on them.
If that is the case, shouldn't this law actually permeate into the homes? I mean, because that's where the children are.
It did not for now. Based on the concerns being raised during the implementation, there could be reviews made. But it will not for now. But if that